Hi there, this is Congressman Andy Biggs from Arizona's 5th Congressional District. Thanks for joining me today. I have a special guest with me today, and very special, Sally C. Pipes. She is President, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute, a San Francisco-based think tank founded in 1979. Ms. Pipes addresses national and international audiences on healthcare. In April 2018, she received an honorary PhD from Pepperdine University School of Public Policy for her work on healthcare reform. President Trump posted on Facebook her weekly Fox News column from August 11th on why union members should be wary of M4A. She also has appeared on ABC's 2020, CNN, Fox News, NBC Nightly News, Fox Business Network, The O'Reilly Factor, Your World with Neil Cavuto. Look, anybody who follows me knows that she's actually been on more TV shows than I have.
It's over a long time period.
Kudlow and Company on CNBC, MSNBC, Dateline, Politically Incorrect, Dennis Miller Show. I missed the Dennis Miller Show. NBC
Yes.
Bay Area's Reality Check on Obamacare with Sam Brock and other prominent programs. She's also writes a biweekly healthcare column for Forbes.com and one for Washington Examiner's blog, Beltway Confidential. She was invited in May 2019 to write a weekly healthcare column for Fox News. Her healthcare opinion pieces have appeared in the Wall Street Journal, Fortune, Newsweek, Washington Post, USA Today, Financial Times of London, The Hill, Real Clear Politics, the New York Times, LA Times, San Francisco Chronicle, Sacramento Bee, U.S. News and World Report, the Boston Globe, and the San Diego Union Tribune, to name just a few. And her comments are included regularly in national media outlets from Politico to the Washington Post. Her views on healthcare also appeared in a special report of the world's 30 leading healthcare experts published by Forbes.com entitled Solutions, Healthcare, and in Steve Forbes' latest book, How Capitalism Can Save Us. She's widely quoted in Shape magazine and in the New York Times Sunday magazine in an article by Princeton's Peter Singer on how Obama will ration your care. She's just done incredible work. She's extremely knowledgeable. I read a lot of her stuff regarding the COVID outbreak, and I told my staff quite some time ago, I've got to talk with Sally Pipes, and so I'm delighted you joined me. Thank you, Sally.
Well, thank you so much, and good luck in the upcoming election. We need all the help we can get right now. So, yeah.
Yeah, you're absolutely right. One of the pieces that you wrote recently is for Fox. What coronavirus data shows it's time for the country to do this. You talked about this move of governors in Oregon, Utah, some others, and as of yesterday in Arizona, their pause on states reopening, or in the case of Arizona, actually closing back down a little bit. Tell us why you think that's a good or a bad idea.
Well, actually, Congressman, I think it's a bad idea. We've been in lockdown basically since early March. The economy is in a terrible situation. We have, at the peak, about 44 million Americans unemployed. I think a lot of those people, are getting that $600 per week supplement from the CARES program. And, on top of their state unemployment insurance has been an incentive for people not to go back to work. And so, they're staying at home. They're actually available to go out and protest and do, all kinds of terrible things. We need to reopen the economy. The number of coronavirus cases in the U.S. as of right now is about 2.6 million. We've had only 811,000 deaths in this country. It's very, very small, and the recovery rate has been great. And so what we're seeing now as these Arizona, Florida, Utah, Oregon, even now in California, the governor has shut down the bars that had reopened. A number of hotels that were going to open are not reopening now. I mean, I think, the number of cases are in particular are among the younger people. And as you know, I'm not in that cohort anymore, but I think that young people are very healthy, and they're not, they may get the COVID. I have a lot of friends whose kids have got it actually in Arizona, but they're sick for a short time. They're not dying from it. And so the public health officials and some of the governors are reacting, I think, in a way that is not a good way, and it's going to hinder opening up the economy. And, as you know, Congressman, the number of deaths, the real hotspots have been in New York City, in New Jersey, and we know in this country 42% of the deaths have been people who are in nursing homes and people over 65, not the younger population. So, and look, when you see these protests, are these protesters, whether it's at CHOP up in Seattle, in Oregon, or whether it's in Washington, D.C., how is it that they can go out and demonstrate and protest and knock things down, and they are not social distancing, and many of them are not wearing masks? So, let's get the economy back on track, and that's going to be very helpful in the election and for our economy.
Well, let's talk for a second about Mayor or Governor Cuomo, because he really is the prototype of how this was handled poorly, in my opinion. So initially, we all talked about flattening the curve, right? And we've moved the goalpost repeatedly over and over again. And now, basically, they don't want anybody to be sick. And I just suspect that on November 4th, we're going to feel very comfortable. That's the day after the election. We're going to feel very comfortable opening everything back up. Tell us about this movement of the goalpost from flattening the curve to now nobody gets sick, nobody dies.
Right, exactly. And we have flattened the curve. And that's what, Dr. Fauci had said, the infectious diseases expert, we have to flatten the curve and then we can start reopening. The curve was flattened. Sure, we've had a few, hot spots, and as we said, among young people who aren't social distancing, not wearing masks. But we have, as I say, we've flattened the curve. We've got to open up. And I think I just saw this morning that Dr. Fauci has said, well, I can see 100,000 new, cases in the next couple of months over the summer. Well, when it gets hot, the COVID isn't going to survive. And if young people get it, as I just said earlier, they are not going to die. It's just like, getting the flu. I mean, we have a number of deaths in this country every year from the flu, but it's just being sick for a week or two. It's not the end of the world, and and all the governors that are buying into this, I think, are really being harmful to our economy and also to the candidates in the election, particularly those who believe in the free market, in capitalism, and America being the greatest country on earth. I'm Canadian. I came here for my job. I'm so delighted to be in America. I left Canada, and one of the main reasons was because the government took over the healthcare system fully, and I could see long waiting lists, ration care. My mom dying from cancer because she couldn't get a colonoscopy because she was too old. So let's make this country and keep it the great country that it is. And if we continue on these paths, Congressman, we're not going to be able to be the great country. And we want to be a country like former, the Soviet Union. I mean, this is not the American way. Americans believe in individual liberty.
Yeah, no, Sally, I mean, you're exactly right. And your comments lead me in multiple directions. But the first one I want to explore with you is geographical hotspots. I mean, you mentioned hotspots. So in Arizona, we have 15 counties. It's this like the fifth largest state in the country. It's massive geographically, but we only have 15 counties. But almost 5 million of our 7 million people live in one county, Maricopa County, right? But along the border, you've got two counties, Yuma County, which has a big port of entry, a lot of cross-border traffic, and you've got another county, Santa Cruz County, with another big port of entry in Nogales. Now, I bring this up because I want your reaction to this. Maricopa County is experiencing per 100,000 just about 1,100 cases, confirmed cases. But in those two border counties, you have about 2,700 in Yuma County, so you have almost 1.5 times, and then you have 3 times that much. I mean 2.5 times. You have over 3 times that amount down in Yuma County or Santa Cruz County with 3,300. And a piece in CNN yesterday talked about cross-border coronavirus transportation or
transmission.
Transmission. So Sally, tell me about that and how that affects what could be going on in Arizona and even in California, because the CNN article focused on California.
Right. So, the border, of course, is a huge issue, and caused a big debate between the Democrats and the Republicans. But certainly, Southern California San Diego County and the counties in Arizona that you've talked about. There's a lot of cross-border stuff going on, and a lot of these people who are probably mainly, for the most part, Hispanic. Some are legal, some are illegals, but they're not practicing social distancing. They're not, wearing masks and things. So there's a lot of, health issues related to how these people think about health, how they manage their own health, and a lot of them are ignorant on, what needs to be done. So you're going to see a lot in the border states across this country, whether it's New Mexico, Arizona, and California. But so we have to be very careful in how this is portrayed, and shutting down full states. Governor Newsom shutting down the bars in 6 counties in California, including our own Imperial Valley County, which has a lot of immigrant workers working there. And it's so, these are different areas, and we have to treat different areas with different types of rules. If you look in New York City, New York, as you know, is a very highly populated, very dense. Most people don't drive. Like in Los Angeles, everyone drives in their car, and the Democrats say you shouldn't be able to have gas, you shouldn't be able to be driving your car. Let's get rid of fossil fuels. But in New York, people have to take the subway or the bus, and many people do. And of course, I think this was a big issue for the transfer of the virus. But it doesn't mean that just because this happened in New York, that people in Los Angeles or people in, Scottsdale or Phoenix, have the same issue. So instead of having a sort of one size fits all, let's have situations that relate to the specific states and counties where there is a problem.
No, that's the point I wanted to make, and you nailed it, because the reality is these broad orders by governors have such a detrimental effect on so many people, and actually a minimal positive effect in certain areas. So it's really too bad that they've taken this massive one size fits all approach. So
one other thing, Congressman, I just want to add that nobody, people need to realize the whole healthcare system, particularly primary care, has been shut down. 600 docs sent a letter to President Trump saying, we know that 150,000 Americans, have delayed getting cancer treatment. So what about people not turning up when they have a heart issue, a stroke issue? These are very serious issues. And the fact that, our docs, our primary care docs, and some of our specialists are having a hard time staying, afloat, because the coronavirus and all these shutdowns is ruining their practices, but more importantly, really having a negative impact on our health, particularly if it's a stroke, cancer, heart. These are big issues, and we cannot overlook the importance of opening up for these things.
Yeah, Sally, so I agree with you. I've been arguing that we're actually creating a larger secondary public health crisis because it isn't just that they didn't get chemotherapy. They have people that are not getting diagnosed with cancer, and the cancer is not going to stop because we're in the COVID. And we've got brain surgeries that I interviewed a doctor about 2 months ago who told me at that point, they already had seen cancellation of up to 80% of all brain surgeries in this country. So and vaccinations for children wanting something like well over 90% were not performed. So you actually gave birth to a completely different public health crisis over there while you're trying to deal with this over here. So just wanted to hit you with this data. So in Arizona, you have 4,700 COVID patients that are hospitalized. That's about 6%. 2 weeks ago, we were over 11%. And so the question really is why would we then shut down Arizona when you actually have a reduction not only in the hospitalization rate, which I think is critical, but also in the mortality rate, which fell from 4.4% 30 days ago to now 2.15% of the mortality rate.
Well, exactly. We're seeing these kinds of statistics all over the country. And I think that that's why it's so important to open up. The hospitalizations are down. Remember, Cuomo said that there would be, there'd be 110,000 people would have to be hospitalized in New York City. Well, the number was actually only 19,000. So these hospitalizations for COVID are fairly small, and in particular among people who are older, people who have comorbidities, they have other issues. A lot of these people who have died from COVID are people who have other, whether it's pneumonia, whether it's COPD, whether it's lung cancer. There's so many things to look into this and to think about and to react. And we should not be, as I say, shutting down. Let the hospitals open up, let the ERs open up. People need to get access to the best care, and to shut things down, it's just going to harm more and more people. As we talked about a minute ago, people with serious healthcare issues that are on being delayed. I'm from British Columbia, where there's a population of about 5 million. And I just read the other day, because the government fully runs the healthcare system, Medicare for all, no private coverage, that they have long waiting lists. The average wait in Canada from seeing a primary care doc to treatment by a specialist is almost 5 months. Now they're saying, because of the COVID and the cancellations of surgeries, there are 30,000 people on waiting lists for surgeries, and another waiting list already of 63,000. People are going to be on the waiting list for over 2 years. The same thing can happen here if we don't, get smart, move away from talking about Medicare for all and public options, and open up the system. Our hospital systems can care and take care of the people that need to be cared for with COVID.
Yeah, and you know what, Sally, we haven't even talked about the mental health issues that shutdowns bring on people, such as the increased suicide rate, spikes in domestic violence, child abuse, drug and alcohol abuse, people who are losing their businesses are having the stress that go with that. I don't know if you saw this, but the U.S. Census Bureau took a survey they sent out a survey to 1 million people, 48,000 responded. And of those 48,000, they had embedded 4 questions that psychiatrists use as a metric for measuring whether someone's clinically depressed. Over a third of the people that responded answered affirmatively and would have been diagnosed as having clinical depression. So you've got this tremendous emotional and psychological issue as well.
Well, exactly. And, a friend of mine is an epidemiologist, and so he's been watching this all very closely, and he's very concerned, as you talk about suicide. One of the biggest causes of divorce in this country is financial issues. And we are seeing a lot of people, having financial issues, and that kind of relates to domestic violence as well, when people are sort of stuck at home. We saw just recently that Stephen Bing, the very, wealthy movie producer, he jumped out of his apartment building in Los Angeles. He said he was depressed. He was tired of, he just had no contact with people. I just can't imagine, if I were living completely alone and locked down, how I would feel. I can't imagine that people don't feel depressed, and suicide is definitely on the upswing. So we've got to start, that's just these are reasons for opening up mental health, delaying getting treatment for diseases that can be controlled. And politicians and, the mainstream media, I think, has really, been at the heart of causing people like governors and mayors and things to really, take drastic action, which is to the detriment of America and our country.
So let's talk a little bit about CDC. Maybe we'll get into Dr. Fauci, maybe not, but let's talk CDC for a minute. So CDC has been wrong on so many of their modeling, and I'll leave that for a second. But one of the things that has come out is that they've estimated that in the U.S., only about 1/10 of the positive COVID-19 cases have been detected and diagnosed. So if that were to be true, it has an incredible impact on how you would view the hospitalization rates. In Arizona, for instance, the hospitalization rate, if you actually had 10 times as many cases, positive cases, our hospitalization rate would be about 0.62%. And the mortality rate would fall all the way down to 0.21%. And what that would mean is you would be below hospitalizations and mortality rates of a seasonal flu epidemic.
Right. Exactly. And so, I mean, the CDC, I mean, between the CDC and Dr. Fauci and a number of these public health organizations that have scared people to death. I mean, when you look at the polling, even though the numbers are down, the deaths are down, people are afraid, to go back to work because they've seen what public health officials have been scaring people with. The CDC, I mean, they were the people with the contaminated tests, the masks that we couldn't, weren't available. Right? Do we want the government to fully take over our healthcare system when the terrible results are coming out of government organizations? So I think, as I talked about a minute ago, the seasonal flu takes a lot of death, takes a lot of lives in this country. And for the most part, COVID, it really, when you look at the per capita number of people who have died in this country, it's low. You keep hearing, oh, the United States has the highest or the second highest number of deaths. Well, you have to look at our population. We have 330 million. You can't compare, a country that has a fewer deaths, like even the UK, but has a population of 63 million. You have to look at the statistics with open eyes. And so the CDC, needs to, just be very careful about what they're saying, because as I say, they've scared people to death, but they are the culprit in a lot of the problems that we've seen with the spread of the COVID early on.
Yeah, and so, I mean, I look at all the conflicting messaging that's come out. So, for instance, Fauci, I'll just pick on Fauci because I always pick on Fauci. Fauci initially said the only time you wear a mask is if you are in a vulnerable population. He said it would do harm to you if you wore a mask, if you were healthy, etc. And by the way, that's been confirmed by many studies.
Exactly.
That was accurate information. And then it became everybody should wear a mask. And wait, what he said is it is a symbol. At that point, he was saying it is a symbol to wear a mask. And the idea would be virtue signaling that we're doing something, even though it's not much. And then now he's taken the position that everybody needs to wear a mask, even though the World Health Organization until 2 weeks ago took the original position, which is the position of all the studies, which is if you're healthy, you don't need to wear a mask. And if you're not in a vulnerable population, you don't need to wear a mask. And now the World Health Organization has come along with the CDC and Dr. Fauci, and they say everybody should wear a mask.
Right. And well, and it's interesting, Nancy Pelosi is now coming out, speaker, saying that, the federal government should take over and say masks should be mandatory for everybody. Well, there's a lot of information about the COVID that will come out over the next couple of years. There's a lot that we don't know. But I think this idea of, everybody wearing a mask, I find, that when I go into the grocery store and I have to wear a mask, I'm sort of panicking that I might, not be able to breathe. I mean, if you wear an N95 mask, if you work in a hospital in an ICU, they're very heavy, but apparently they keep out the virus and they don't let the virus go out. But a lot of these sort of light cotton masks that people are wearing, I just don't see that it's worth anything. And I think that it's really a shame that, California, the governor says everyone has to wear a mask. It's just so frustrating, and it's so much the whole issue of government is now taking control of our lives, and we're seeing this over and over again. And that is what I find the whole idea of individual freedom, personal responsibility, has gone out the window, and we're looking at this country being a society based on government and government entitlement programs. And government doesn't have money. We have money and we pay taxes. And we're going to be facing huge tax increases. I can't see any other option in this country because of the steps that the public health officials and governments have taken.
Yeah, it's been pretty amazing. I want to switch gears to something else that's related directly to this. Yesterday, the American Academy of Pediatrics came out with a position paper. And they give some specifics on what they think should happen with regard to children and opening schools.
Right.
But they did say some things that I think are pretty important. they said two things. They said local communities should open up schools again because that's what's best for children. And then the second thing it said is we've already learned since schools were shut down in the spring of 2020 that school closure and not being able to go to schools has caused a tremendous harm to children. Talk to me a little bit about opening up schools for children. What's the real danger there?
Well, as we talked about, young adults are probably, they may have the virus, but it's asymptomatic. They don't even know they have it. Young people, we haven't seen huge numbers of young children with the COVID. I think the bigger worry is that these children have been denied going to school and they've had to stay at home. In many cases, the families don't have the kind of Zoom equipment and computers that people like you have and I have so that we can do this Zoom call. And so these children have been, denied school March, April, May, and June, and they're not learning anything. How are they going to catch up? We have a real problem in this country with trying to graduate, engineers, mathematicians, scientists, because that's a key part of our society. These children are being denied that. So I think it's very, very important that the schools be opened up. It's just, the chance of them getting the COVID is very small. I just saw that in the UK, Boris Johnson has said that the British schools are going to open in September as planned. We need to do the same. And you can do, if you're in a hot zone, you could have half the kids come in the morning and the other half in the afternoon. The other problem is, what about parents who have children at home that can't afford to have nannies and things like that? It's very, how can they even go to work if they can go back to work if their kids are at home and not at school and not learning? Digital learning is a great thing, distance learning, but not all children have the option and the opportunity to take advantage of these programs. So you need to get back and get into a structured environment and start learning, because we need a workforce that is going to help this country as it comes out of the pandemic and going forward. We want to be, we want to be better than China, better than other countries, that India. We have to have the best trained people, and if they're not allowed to go back to school, I think it's a shame. And I think the American Association of Pediatrics is right in saying, let's get kids back to their schools. We're looking at the colleges, Cal State University system. There will be no in-class teaching until at least till January 2021. Well, not all kids at Cal State, have computers. Some of them have jobs. It's going to be that's even more worrying, I think, about sort of our young people who are college students who might be really adversely affected by not being able to have in-class teaching.
Well, we know that there are in Asia, in Japan, South Korea, Taiwan. We also know in Europe, several states, Sweden, for instance, have actually opened up schools. They've gone back to school.
Germany.
Yeah, in Germany, that's right, and several others. But I mean, have you heard of any negatives? I saw that there was one. I'm trying to remember which country it was that said they're going to slow down on that just a little bit. But by and large, most of them haven't seemed to have huge problems with going back to school.
Right, and Germany and Denmark were the early countries that opened up. I'm not counting Asia, but in Europe, and things have been fine, and they're going to be educating kids that are going to be part of the German workforce or the Danish workforce, and so we're really putting our kids at risk by not reopening schools. And so it's very important, and education is, you can't do anything if you're not educated. I mean, I think a lot of the people in the protest movement, as I said earlier, are people who, are locked down and can't go to work, and they don't have other, hobbies, whether it's tennis or running or whatever. And so they're going out and causing trouble, but they're not being productive parts of our society. And we can't, have, all of this destruction and things that are going on right now. So open the schools, get kids educated so that we can be a competitive force in the global environment, because we are in a global economy these days. It's not just California or not just America.
Well, Sally Pipes, thank you so much for joining me today. We've actually, that was a fast half an hour, and it's
too fast.
It went by all too fast. I appreciate your information, all your work and your writings and your TV appearances, advocating for a market system, free market system, and I hope that we can get a chance to talk to you again soon. Thank you so much, Sally Pipes.
And good luck in the election. Thank you.
Thank you.